Good day everyone, I am Loj Estrada from MSU 1 and today I am going to perform changing an unoccupied bed. So it is changing a type of hospital bed that does not have a patient in it. So this is to meet the patient's need by providing a safe, comfortable bed and for neatness and tidiness. So prior to the conduct of the procedure, I am going to provide the equipment. So we have the bottom sheet, the absorbent pad, the pillow and the pillowcase, the top sheet we have here, the blanket also, and the draw sheet. Then we have the hamper, this one, the hamper, also gloves. So we have here the gloves. So considerations before, during, and after the procedure. So before the procedure, you must guarantee that all necessary equipment is available. Then, maintain a level of privacy. Then during the procedure, always remember proper body mechanics to prevent overstretching or body straining and make sure to do so. Then, always wear gloves when changing a bed. Then, follow the necessary standard correct procedure in doing so. After the procedure, document the result. Then we have things to document after the procedure. Record procedure done in changing an unoccupied bed. So, first, perform hand washing. This prevents the spread of microorganisms. Then, gather all the necessary equipment arranged on a chair by the bedside in the order in which items will be used. This is to save time and effort for an orderly procedure. So, I have already arranged it by the bedside table. Then, raise the bed to an appropriate working height, don on gloves if handling soiled linens. This is for proper body mechanics, prevents cross-contamination via soiled linen. Then, place a chair at the foot of the bed and lock the bed. Remove pillowcases and place pillows on a chair or at the bedside table. So, securing the bed is important to avoid injury. Then, loosen all bedding systematically, starting at the head of the bed on the far side and moving around the bed up to the head of the bed on the near side. So moving around the bed systematically prevents stretching and reaching and possible muscle strain. Then, fold reusable linens such as the bedspread and top sheet on the bed. Folding linen saves time and energy when reapplying the linens on the bed and keeps them clean. Then, remove all the waterproof pad and discard it if soiled. This prevents cross-contamination via soiled pad or linen. Then, roll all soiled linen inside the bottom sheet. Hold it away from your uniform. Place it directly on the hamper and not on the floor. So these actions are essential to prevent the transmission of microorganisms. to the nurse and others. Then, remove gloves and do hand washing. This prevents the spread of microorganisms. Place the folded bottom sheet with its center fold on the center of the bed. Spread the sheet out over the mattress and allow a sufficient amount of sheet at the top to tuck under the mattress. Place the sheet along the edge of the mattress at the foot of the bed and do not tuck it unless contour or fitted sheet. So the top of the sheet needs to be well tucked under to remain securely in place, especially when the head of the bed is elevated. Then, miter the sheet at the top corner on the near side and tuck the sheet under the mattress, working from the head of the bed to the foot. To miter the corner, pick up the salvage edge with your hand nearest the head of the bed. Then, lay a triangle over the side of the bed and then tuck the hanging part of the sheet under the mattress. Then, drop the triangle over the side of the bed. And lastly, tuck the sheet under the entire side of the bed. So this secures the sheet to the bed. Then, if waterproof draw sheet is used, place it over the bottom sheet so that the center fold is at the center line of the bed and the top and bottom edges extend from the middle of the patient's back to the area of the mid-thigh or knee. Unfold the uppermost half of the folded draw sheet at the center of the edge of the bed and tuck in the near edge. So, if the patient soils the bed, the draw sheet and pad can be changed without the bottom and top linens on the bed. Having all bottom linen in place before tucking them under the mattress avoids unnecessary moving about this bed. So, a draw sheet can aid moving the patient in bed. Lay the cloth draw sheet over the waterproof sheet in the same manner. A draw sheet can aid in moving the patient in bed. So, for optional, before moving to the other side of the bed, place the top linens on the bed, hem side up. Unfold them, tuck them in, and miter the bottom corners. So completing one entire side of the bed at the same time saves time and energy. Then, move to the other side and tuck in the bottom sheet under the head of the mattress. Pull the sheet firmly and miter the corner of the sheet. Pull the remainder of the sheet firmly so that there are no wrinkles. So this secures sheet to the bed. Wrinkles can cause discomfort for the patient and breakdown of skin. Tuck the sheet in the side. Then, complete the process for the draw sheet. For an orderly procedure. Then, place the top sheet hem side up on the bed so that its center fold is at the center of the bed and the top edge is even with the top edge of the mattress. Unfold the sheet over the bed. This ensures appropriate coverage. So for optional, Make a vertical or a horizontal two pleat in the sheet. For vertical two pleat, make a fold in the sheet 5 to 10 cm, 2 to 4 inches perpendicular to the foot of the bed. For horizontal two pleat, make a sheet 5 to 10 cm or 2 to 4 inches across the bed near the foot. So this provides additional room for the patient's feet. Then, follow the same procedure for the blanket and the bed spread, but place the top edges about 15 cm or 6 inches from the head of the bed to allow a cuff of sheet to be folded over them. So this is for an orderly procedure. Then, tuck in the sheet, blanket, and bedspread at the foot of the bed and miter the corner using all 3 layers of linen. Leave sides of the top sheet, blanket, and bedspread hanging freely unless towel pleats were provided. So this ensures appropriate coverage, secures sheets to the bed. Then, fold the top of the top sheet down over the spread, providing a cuff. So the cuff of sheet makes it easier for the patient to pull the covers up. Then, move to the other side of the bed and secure the top bedding in the same manner. This is for an orderly procedure. Then, grasp the closed end of the pillowcase at the center with one hand. Gather up the sides of the pillowcase and place them overhand, grasping the case. So then, grasp the center of one short side of the pillow through the pillowcase. This completes bed preparation. With the free hand, pull the pillowcase over the pillow. Adjust the pillowcase so that the pillow fits into the corners of the case and the seams are straight. A smoothly fitting pillowcase is more comfortable than a wrinkled one. Place the pillows appropriately at the top of the bed. This is to provide comfort for the patient. So this is now the closed bed. Place pillow on bed with open end facing the wall or place pillow on the bedside table. So preserves bed when patient is out of room for extended period or when new patient is expected. For open bed, pull top of sheet and blanket to head of bed and unfold both back neatly to bottom third of the bed. So this prepares bed for patient when return is expected momentarily. For post-operative bed, make an open bed but do not tuck the top sheet and blankets, leaving top sheet and blanket unfolded to the side of bed opposite door. After patient is transferred to bed, pull covers across bed and tuck and miter at bottom. So facilitates moving patient from stretcher to bed without prolonged exposure of draft. This prevents interference of patient transfer to bed-by-bed linens and makes covering the patient easy. This secures the linen of bed. So this is the closed bed. So this is now the result after I mitred the linen. Then dispose of soiled linens accordingly to hospital policy. This prevents the spread of microorganisms and cross-contamination. Okay, I'm now going to dispose the linens used. Then do hand washing. This is to prevent the spread of microorganisms.